Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, what do the declines in journalism have to do with mistrust around health? We have three guests on today's episode. Journalist Joanne Kenen, Associate Dean of Communications at the Johns Hopkins Bloomberg School of Public Health, Lymari Morales, and Public Health on Call co-host Dr. Josh Sharfstein, all co-authors of a new book, Information Sick: How Journalism's Decline and Misinformation's Rise Are Harming Our Health and What We Can Do About It. They join me to talk about what it means to be information sick and how institutions, organizations, and individuals all play a role in the treatment. Let's listen. Lymari Morales, Joanne Kenen, and Dr. Josh Sharfstein, welcome to Public Health on Call. We are so happy to have you. You are the authors of this book, Information Sick: How Journalism's Decline and Misinformation's Rise Are Harming Our Health and What We Can Do About It. To walk through this book, we want to start out with the idea of information sick and that this is a diagnosis of society, of where we are, and that there are some symptoms that led to this diagnosis. Josh, would you lead off with that?
Sure. As the clinician in the bunch here, I'll start with the diagnosis. We think of information sick as a diagnosis both for individuals and for society. So an individual is information sick when they are in a world of information and a sea of information that is not accurate and that is leading them to make decisions that are actually harmful to their health or the health of their loved ones. It could be someone who is declining to take a legitimate, proven treatment for cancer because they're reading online that it's much better to switch their diet in some way. It could be someone who is refusing to take a vaccine that could prevent a horrible complication, or not vaccinating their children for reasons that aren't based in scientific evidence. It could be that someone's afraid to sign up for health insurance because they've read that it involves rationing and death panels when in fact those don't exist. All those things are hazardous to a person. But then when that happens to enough people, you wind up in a situation where society is information sick. And when that happens, we're not using the power of science and medicine and health to improve our lives. Even though we're in a world where so much great information is available at the touch of a button on all of our phones in our pockets, we're nonetheless getting led to policies and cuts and other major decisions that are actually making it harder for the country to overcome serious health problems, to extend life expectancy, and to address serious gaps in health that exist in every corner of the country. And so it's bad for individuals, it's bad for society.
Let me ask you one more question from your clinician standpoint. What's the prognosis with this kind of diagnosis?
Well, I think we've got a little bit more to talk about on this podcast before we get there. In some sense, there's reason for concern, but there's also some reason for optimism.
Well, let's talk a little bit about how we got here. When we talk about any kind of disease, and especially at a population level, we talk about root causes. So, Joanne, what are some of the root causes of this diagnosis?
Well, when I was thinking about how to wrap up where misinformation and disinformation is coming from, I thought about that movie, the Oscar winner from a couple of years ago, Everything, Everywhere, All at Once. Misinformation, disinformation, it is just like raining. It's bubbling up and it's raining down and it's blowing and it's just everywhere. And what our book does is sort of look at an intersection that hasn't been discussed before. Misinformation comes from people who just get stuff wrong but aren't intentionally. They heard something that their next door neighbor's brother-in-law's ex-wife's poker partner, told them, and it just takes off, right? Misinformation comes from people who are trying to make money by getting us to do alternative things. And I'm not saying all alternative things are terrible, but some are, and people make a lot of money, millions and millions of dollars. These are big businesses in some of these things that are peddled to us that do not enhance our health and may, in fact, harm us. It's intentional. And then there's also some that does come from overseas actors, from countries that we're not on particularly terms with. So it's coming from a lot of places. And conspiracy theories, some sort of a subtype of people who believe in things. So these people don't think they're telling you misinformation. They're trying to be helpful. They're trying to show you open the door and shed the light. At the same time, we've had a transformation of American journalism. Local newspapers and local radio and TV are all, there's less of it. There's less local. There's fewer reporters. There's fewer papers. There's fewer editors. If you're a little paper in a small community, and it's shrunk and shrunk. Even if it's gone away and it's not there anymore, there's no local news. And that's true in a lot of the country. It's called news deserts. But say you still have a community paper, but the poor person who used to cover health and education is now covering health, immigration, transportation, many, many things. They don't have expertise, and it's not their fault, really. So that means that some of what they report is not as factually as correct as if they had more time and more expertise, or they do a lot of what we call false equivalency, which is you don't know who the charlatan is and who the expert is, and you treat them like on the one hand, on the other hand, like they're both the same. And the national media, which is also facing cutbacks and closures and buyouts, there's a lot less policy reporting. So, the information has a lot of space to spread when the traditional media isn't there to stop it or to counter it.
Yeah, I was going to ask you if there's a difference here between digital, maybe online versus in real life when it comes to these root causes.
I think it's sort of a mishmash now. It's coming at us online. They're ideologically driven on both sides, liberal and conservative media outlets that are telling two very, very, very different stories. It's why I don't watch a lot of TV. It's in the news we read, it's what we watch, and obviously in the podcast universe, not this one, in social media sites, there's just, it's volcanic. It just keeps exploding.
I would say that one of the things we try to do in the book is make the connection between these different trends and the situation we're in. So the decline in journalism could have just happened by itself, but it happened at a time when social media was becoming available and all this false information began to circulate there. And you bring those two things together and there's less good information, more bad information, torrents of it in some cases, and how we wind up information sick.
With all of these torrents of misinformation, and Joanne, let's go back to you because I think this is a huge part of the root cause. A lot of it is coming from social media. Where is the accountability for there to be any sort of checks and balances on this information?
It's pretty much, the Wild West of whatever social media site you're on. And in the last year or so, the few guardrails that there were, they've been rolled back. There's a lot less fact-checking and restrictions. It's not necessarily only in health, but in, it's very much, an anything-goes environment. Some of the self-imposed things that some of the sites were doing are now gone. And at the same time, a larger issue here is that our country, we're suffering this huge crisis of trust. We don't trust each other. We used to have Democrats and Republicans, but we didn't have the chasms we have now. So you've got all this wild misinformation, and people don't trust who they used to trust. We don't know who to trust. We think the other side is lying, and sometimes they are. We don't particularly trust the healthcare system. We're worried about all sorts of things. We call it information sick. You could probably call it, it's a form of information anarchy as well. That it's very, very hard. I think all of us, we've fallen for stuff, right? And people we know and families or friends have fallen for stuff, even though they're smart and thoughtful. We all sort of get sucked into something at some point.
So we have the symptoms and the diagnosis, and we know kind of some of the root causes, but I want to spend time talking about the treatment, and even one step further than that is the prevention. And so, Lymari, would you lead us off by talking a little bit about some of the treatment, which is a role that I think institutions can fill?
Sure. Thanks, Lindsay. And I come to this conversation and to this book as the comms strategist in the group. And I lived through some of these changes in journalism, having started in broadcast journalism. And I work in this environment every day, leading communications for the Johns Hopkins Bloomberg School of Public Health. So I think overarching, our book argues we really need to first understand the environment that we're working in when we're seeking to communicate. And the book does a great job of laying out the different things that have happened to get us into this situation. And I'll just also add that, all industries go through disruption, and the industry of sharing and consuming information is always in constant state of change. However, the speed and the volume have been greater in recent years, and the stakes are higher in the case of information when it comes to our health. But we really need to understand the environment, and then we need to invest in skills and strategies to help good information travel farther into the right audiences. And so investing in skills that help communicators in all types of organizations understand and communicate both substantively accurate, credible, grounded information, and also style of communicating in the formats and channels that audiences today are spending time with. We talk about how many nonprofit institutions have stood up good communication sites to help share credible information and work across channels. And we also talk about how organizations such as ours and academia have an opportunity to be a part of this solution as well. Again, but you have to invest in the teams, the strategies, the skills, and mastering style and substance.
One of the questions I have actually is that, institutions in particular, when we were talking earlier about trust, how can institutions use these kinds of things to build trust? Because in order for people to take the treatment, to be willing to accept the treatment, they have to trust where it's coming from. Where does that come into your work?
Sure. In the book is a couple different things that you can bring into that trust building. One is sharing context around the information and trying to share how we arrive at a recommendation or at a point of view. Also engaging community leaders so that we can understand what people are hearing, what questions they have. In fact, this podcast was born out of answering questions that people have. And first, in order to answer those questions, you really need to listen to understand. And so find ways to really understand what questions are out there in the community, whether that's through social listening or working directly with community organizations and leaders, and then seeking to empathetically acknowledge and address those questions.
If I could jump in for a second, I would say that part of the solution is to rebuild journalism. And one of the chapters in the book is about the rise of nonprofit journalism. And another chapter in the book is about new forms of journalism that are focused on particular issues or serving particular communities. And people may not be that familiar with them. As one example would be the trace.org, which is essentially online journalism about gun violence. And they do incredibly interesting work. Very, very relevant to policy and can be very influential and helpful to the policy process. That is filling a gap because there's much less policy journalism going on right now in the media. So in different ways, supporting journalism is important. And it's interesting because, historically, the health sector and the journalism sector, I wouldn't say have been enemies, but maybe they have been a little bit at odds because, of course, journalism has to cover health. I think we can expect that will continue as it should. But at the same time, I think both sides can recognize that, in a sense, there's a common challenge that they're facing. The bottom dropping out of the information environment is terrible for journalism. It's terrible for health. And there has to be a way to work together.
So a lot of your book is talking about this kind of institutions and journalism and these larger entities, but you also have some information in here about how people can protect themselves, and you use the metaphor of inoculation. And so open question here for whoever wants to jump in. What does it look like to inoculate yourself to avoid becoming information sick?
I'll jump in and say we want to encourage people to pay attention to their information environment, both in the real world and online. And ideally, there are sources of good information, trustworthy sources in your world. It could be your doctor or nurse. It could be from a health communicator in your community that you know and have trusted for a long time. But then also online to find places and resources that make sense and be cognizant of that environment, even as you are experiencing other environments, to see what other information is out there, to kind of have a home base of good information that you can trust. That I think is a really good thing for people to have. And more generally, we should be trying to make it easier for people to do that.
Joanne?
We include in the book, and there are online sources. You can go to resources like factcheck.org. You can go to, medical institutions, Johns Hopkins being one of them, Mayo Clinic, Cleveland Clinic. There's a bunch of schools, med schools or medical institutions or public health schools that have plain English stuff. Like as a mom, I was Googling, it's 2 a.m. or I'm just trying to understand something that, a friend or relative might be dealing with. So there is information out there. There are organizations like factcheck.org. There's a Spanish language version, which we should call out too, called Fact Checkiado, because Latino communities are really targeted. On the other hand, those of us who are more likely to go check are those of us who are probably less susceptible to misinformation in the first place. That, if I am not sure about something, I may go look for it. But when the pandemic broke out, I wasn't at Hopkins. I was at full-time. I'm still a journalist, but I was running healthcare Politico, and organizations like Hopkins. I lived on their website. They had all this publicly available data that I could understand, and they put out experts, and it's just that's really important, and we have to just keep doing that. All the things that Lymari and her team do, we just have to keep doing them and doing them and doing them. At the same time, there's pieces we don't really understand, because if that was enough, we wouldn't have vaccination rates dropping. We wouldn't have the distrust in medicine deepening. So we have to figure out how to do more and better.
Let's go back to one of my original questions. Lymari, maybe let's start with you. What's the prognosis, do you think, from your standpoint?
I think we just have to keep at it, right? Through all of these different channels and through all of these different organizations. I think a key takeaway is it's going to take many different voices. So including, the traditional journalism, the nonprofit journalism, academia, clinicians, health agencies. We all need to work together to help good information travel and reach the right audiences. And so, one of the things we talk about in the books is really thinking about repetition, repurposing, and resurfacing. So in public health, we have a lot of great guidance and a lot of great recommendations that we have shared before and still have a ways to go to reach all of the people who can use that information. So we need to keep at it across organizations. We need to keep at it across channels. And we can think about different inroads for different audiences as well. And again, understanding different audiences' vantage points, what type of information they might be consuming that is affecting their point of view and their lens with which they view good information. And also, I think we need to let go of, wanting credit or web traffic, people to come to us, and really think about the greater good and how we can work together to get good information out to people who need it, can benefit from it, and to improve health through good information.
And then, Joanne, from your standpoint as a journalist, what's the prognosis here on journalism?
Well, as Josh pointed out, there's some really great bright spots. If you look at even the Pulitzers the last few years, some of these little tiny, 3 to 5 or 8 person nonprofit news outlets have been behind some of the best reporting in the last few years, right? Just whether it's health or political scandals, they're doing magnificent work, but they're small. Some of them are going to go broke. Some of them have gone broke. It's challenging. There's also there's a lot more efforts to train local journalists. I also think that some of the consolidation of the industry, not the new nonprofits, but the traditional political alignment is something we didn't have traditionally, right? People tried at least to be more neutral and more in the center. It wasn't perfect, but that was the goal. There's a lot of money behind media outlets that are changing hands, and there are media outlets who are redefining what it is to be appropriate or what their role is and who they align themselves with, as opposed to trying not to align yourself with anybody. We don't know who's going to end up owning TikTok, which is enormously influential, and what they're going to do with the algorithms. It's another something to worry about. And so there are things to be hopeful about. Yes. Are there things to be terrified of? Yes.
So Josh, we'll end with you as the only person on this call who can actually prescribe medication. What would you prescribe to individuals, knowing the prognosis, knowing the diagnosis?
Well, there's no miracle cure and there's no vaccine. There's no simple solution. This is more like a chronic illness. So it's a range of different things. There are solutions for journalism, there are solutions for organizations and institutions, and there's things that each of us can do to clean up our own information environment and protect ourselves, our families, and those around us. That's why we wrote the book.
Well, Josh Sharfstein, Lymari Morales, and Joanne Kenen, thank you so much for joining us.
Thank you for having us, Lindsay.
Great. Thanks.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.